Okay, so the system that we're going to be going over, it's very similar, but obviously it's Kelly's competitor. But as I said, we have to utilize all our resources. And so this is my name is Priscilla Seaborn. Just to kind of introduce everyone, I think I've been in contact with many of you via email. And so I am currently an APHL CDC COVID-19 associate. And so my job is to act as a liaison for training with these point of care tests. And that includes the Abbott Binax Now, the BD Veritor, the Quidel Sophia, and now that I've been trained, hopefully the ID Now. And Dr. Kettlewell is also on the phone call. She is also assisting with this effort. And this is primarily because I'm currently expecting, and so I will be going on maternity leave very soon. And so when that does happen, Joanna will act in my place and go ahead and provide training. And so thank you everyone for attending. We wanted to get as much people as trained as possible today because eventually we're wanting to use a train the trainer approach, especially for our outer islands, and just kind of get everyone up to speed on these current testing measures. So here I have the BD Veritor System, and so it's a little bit, it's kind of like a bright orange instead of the Binax kind of pink and blue. And very similar to the Binax Now, so a lot of this is going to be kind of repeated actually, so I think this presentation will go by rather quickly because Kelly went ahead and explained this for me. And so the BD Veritor System, this is different from the Binax in that rather than having to read the result with like a line and everything, this actually is a chromatographic digital immunoassay. And so it'll actually digitally display a positive or a negative result. And like the Binax Now, it actually looks for the nucleocapsid protein that is present on the SARS-CoV-2 virus, which is here. And this is detected in the nasal swabs. So similar to, again, the Binax, it is a lateral flow immunoassay. And so this is kind of similar to, I kind of tell everyone, like a pregnancy test. And this assay, essentially, you are looking for the presence of the nucleocapsid protein in a nasal swab. And so BD Veritor also provides an extraction reagent that you're going to mix the nasal swab with. Once you mix it, nucleocapsid proteins, if present, will go ahead and hopefully come out into that extraction reagent. That reagent is then added to the testing membrane. Well, it will move up the testing membrane via capillary flow. If nucleocapsid is present, it's going to go ahead and bind to SARS monoclonal antibodies that have been conjugated with, some type of fluorophore. Every system has its own type of thing that they use. I believe Binax Now uses a fluorophore. I'm not 100% what BD Veritor uses. And so if it's present, it's going to go ahead and bind to these antibodies. And again, it's going to bind here to the testing strip and display as a positive result. And then again, every system has a control line just to serve as an internal control and make sure that the whole testing membrane is working appropriately. Now, again, the BD instrument is different in that it will actually provide an objective result in a positive or negative, or it'll say invalid if the control doesn't work. Reagents and materials that are provided. So this is one of the BD kits, and so this is actually has the extraction reagent, which is it'll come into this kind of like yellow tube, or sorry, this clear tube with a yellow cap. It will have sterile specimen swabs for nasal swabs, and then it'll have the testing cartridges. It will also come with a positive, which is here in red, and a negative control, which kind of serves as the external controls. Comes with a cardboard tube rack, which is really nice when you're doing this whole test. And this silver packet has the extraction reagent tubes. And the great thing about this is they're pre-filled, so every tube has extraction buffer in it already. Things that are not provided, but you actually need to go ahead and analyze the test. This BD Veritor Plus analyzer, so this would be ordered separately. And so here it is, and then it comes with this reader verification cartridge, and this just is ensuring that the analyzer is working appropriately. Like Kelly said, it's really nice to have a timer and also personal protective equipment for when you're performing these on someone that is potentially infectious with COVID-19. So again, this is just kind of a close-up of what's included in the kits. Storage, the good thing about these systems is they all seem to have the same storage specifications. So the BD Veritor needs to be stored at 2 to 30 degrees Celsius. So that is anywhere from being at room temperature to, in the refrigerator to room temperature. If you are going to store this in the refrigerator, like Kelly said, it's important that before you actually perform sample testing, that you let it acclimate to room temperature before you perform any type of testing, and that could be either the quality control or the patient sample, because it can actually invalidate the results. And so do not freeze the kit. So most of these kits, I'm not sure if it's the extraction reagent that gets affected, but most of them specify that to not freeze this. And again, just allow it to acclimate to room temperature before you use this for any type of testing. The recommended PPE before you're actually going to swab someone that might be infectious with COVID-19. So having a mask, either like an N95, a disposable mask, a face shield or safety goggles, disposable gloves, and then some clothing protection. So either a disposable lab gown or a lab coat. Now, the first step in the BD Veritor, this is just for the analyzer. So this really doesn't necessarily have anything to do with COVID-19. This is just to make sure that the analyzer is reading controls properly. And so this is a reader verification cartridge. They recommend doing this before the morning, as soon as you get this kit, but also the morning that you're going to start doing patient testing, just to really make sure that the analyzer is reading these lines appropriately. And so I actually have a video, so we kind of pre-recorded. So this is the analyzer, and this is the reader verification. So it's this nice bright orange, and it's a resealable packet. So you're going to turn on the analyzer just by clicking the power button once. And it's going to perform a self-test very quickly, and it should say self-test passed. And then it will say insert test device or double click for walkaway mode. But for this, we're just going to insert a test device. Okay, so I'm going to open up the reader verification cartridge. And again, this is resealable, so you want to keep this with your kit. And it looks like that. Okay. And then you're just going to insert it into the test slot. Okay. It'll take 3 seconds to read, so it'll show like that, reading 3 seconds. And it should say verify pass. Now, in a situation where it does not pass, I recommend testing this again. If it still does not pass, I would go ahead and mark that analyzer and just go ahead and either contact BD Veritor Technical Services, which I have the email at the end, or contact myself and we can see about helping getting a new one, because essentially this is just ensuring that the analyzer is working appropriately. Again, if the system fails, do not test patient samples, because it's very likely that it's not going to display the correct result. Okay. So this is just kind of the outline that I like to go over with people. I always recommend, obviously, preparing the workspace before you're about to perform any type of testing. Then we will go through collecting the nasal swab, adding the nasal swab to the extraction reagent, performing the test, and interpreting the results. So again, this is just kind of good practice, good laboratory practice, or just good practice in general. Just have everything that you need for any type of testing. So you're going to need your analyzer. If you're performing a quality control, you're going to want your negative and positive control. Or if you're doing the sample testing, you're going to want a nasal swab. I would get out the tube rack and then get out the tubes that have the pre-filled extraction reagent. So collecting the nasal swab. So you guys by now are probably pros at this just from hearing, now 3 lectures on it. So it is the same protocol as the Binax Now. So you're actually going to, the BD Veritor kit provides sterile nasal swabs. And so the same method, you're going to insert the swab into the nostril with the most visible drainage. And you're going to do this about 1 inch. Again, this isn't a nasopharyngeal swab, and so don't go too far back. It's just a nasal swab. Then you're going to rotate the swab about 5 times against the nasal swab, remove it, and then repeat into the other nostril. And I actually kind of swabbed myself just to show. And so here, just about 1 inch. Okay. And I'm just kind of, rotating it against my nasal wall. I did feel a little bit of resistance, so, that's normal, but just, again, not too far back. Because these are kind of big swabs. Okay, and now that sample is ready to test. So here, another video, let me just mute it. This is where we're now going to add the nasal swab to the extraction reagent. So this is what the tubes look like. So they're clear with a yellow cap, and they have the pre-filled extraction reagent in them, which is really nice. So you don't have to worry about measuring or anything. Okay. Now this one actually, so I ended up that nasal swab was taken at another time. So I'm actually going to be testing a quality control. But it's the same procedure. So you can just kind of pretend that this is a nasal swab. So this is a negative control. And so just going to open that. It's in that silver packet, and it's nicely labeled. The only thing is that each system only comes with 1 negative and 1 positive control. So it kind of has a blue tip there. Okay. So I'm just going to open the cap. It's a little bit snug, so you do kind of have to apply some pressure. Okay. So then you're going to take the swab, and this is the control or the nasal swab, and you're going to rotate, you're going to go up and down for 15 seconds. Okay, so you're just trying to get as much potential antigen into that extraction reagent. Okay, so I'm kind of mixing and just kind of counting. Then when you take it out, you're going to squeeze the bottom, and you're trying to just get as much liquid from that swab into that extraction reagent. And then I'm going to turn the volume up just a little bit so you can hear this click. When you close the tube, there should be a click. Yeah, just a little one. And again, it's a little bit snug, so you do have to apply some pressure. Okay, now we will prepare to add it to the test cartridge. So I actually had a little bit of trouble opening this test cartridge. So again, that's kind of, it's not hard, it just takes some force. So that's the test cartridge, and it kind of tells you, you're going to add 3 drops on the side. So like the Binax Now kit, it'll kind of tell you. So you kind of wiggle the fluid to the bottom and then just add 3 drops. And you just want to make sure that you're not touching that dropper to the test kit, okay? Once you add the 3 drops to the test cartridge, this is where it's going to be nice to have that timer and just go ahead and set it for 15 minutes, okay? Now, BD is a little bit different. Their analyzer has a analyze now mode or a walk away mode. And so I'm actually just going to show you. So this is a lot of text, but I think it's a little bit better to just show. Okay, so this is after 15 minutes have passed. Okay, so I'm going to do the analyze now mode. So what we're going to do, I'm just going to pause it. So the device will say insert test device or double click for walkaway mode. So if you're going to do the analyze now mode, what you're going to do is just add the 3 drops of the extraction reagent, set your timer. Once the timer is complete, then you're going to insert it into the analyzer. So you're not actually, the only thing you're going to do is just power on your analyzer just by clicking the power button. And then it should display this result after the self-test has passed. Then you're just going to insert it into that test slot. It'll take 3 seconds to analyze the result. And again, it will just display, so it'll say CoV-2 negative or CoV-2 positive. This was a negative control, so it makes sense that it's negative. And so the great thing about the Analyze Now mode is, once the 15 minutes has passed, you just insert it into that cartridge and then 3 seconds and it'll give you your result. I think that's it with the video. Yep. Okay. Oh, this is just the same video. Sorry about that. Okay, so then there's another method. So there's a walkaway mode. This is great if you are, busy with other things, as we all are, and you just need to insert, the 3 drops into the test cartridge, but you need to kind of go somewhere just for a bit. Now, this is a lot of text, so I'm just going to go ahead and explain it with the video. So this one, you're actually going to, so again, it says insert test device or double click the power button to walk away. So I'm going to double click and it's going to say add specimen test device and insert immediately. So after you add your 3 drops of the extraction reagent into the test cartridge, this is where you're going to want to set up your walkaway mode, and then you're just going to insert the test cartridge. Now the great thing is it'll say do not disturb test in progress, and it will automatically do a 15-minute timer. So, the interpret now mode or the analyze now mode, this is assuming 15 minutes have already, gone by and the cartridge is ready to be analyzed. This one, you have just added the 3 drops and now you just kind of want to walk away for a bit. So it will automatically do a 15-minute timer for this assay, and it'll say do not disturb test in progress. Now, again, I recommend, either having a patient label on this test cartridge or, just some way to identify who this sample is, okay? And so, yeah, it'll just kind of go for 15 minutes. Now, again, you do want to make sure before you insert the test device, sorry, trying to do the video, I guess I have to hit play, double click, and just make sure that it's saying it'll give you about 3 minutes to add the test cartridge. Okay, so it should look like that. There has been, I think, some situations where people thought it was in walkaway mode and it wasn't. And so just be careful that, you actually set it into the walkaway mode. And it's pretty easy. You just kind of double click this power button. Okay. Interpreting the results is really nice with BD Veritor, so you don't have to read any lines. Again, it uses adaptive read technology, and so it will just show an objective digital result. So if the patient or control is, it's a positive control, it will say CoV-2 positive or CoV-2 negative. Now, the control invalid, this is something that can happen obviously with any kit. If your control doesn't show up, this is also something that may happen if the analyzer is not working appropriately. And so I believe I can't remember the exact number. I think the analyzers are good for about 2,500 tests, but after the presentation's done, we'll go ahead and verify that. But this is something that can happen if the analyzer is maybe nearing its end of life. And so, again, this is why it's important to perform that reader verification before you start testing any types of patient samples. If this happens, unfortunately, we need to redo the test. For disposal, these are all considered biohazard waste, and so they need to be disposed into the appropriate receptacle. And it also, use an appropriate disinfectant to clean up the testing area. So FDA actually has this website, it's called Checklist N, and it will allow you to see if the disinfectant a facility is currently using is appropriate to kill SARS-CoV-2. And I went ahead and installed a live YouTube link on how to navigate that website. So with any kit, this is very, again, similar to what Kelly was saying. It needs to have an external positive and external negative control. These are provided with each kit. And again, these just allow you to monitor the overall assay and just to make sure that the testing reagents and the cartridges are working appropriately. Now, again, it's recommended for each new kit lot number, new operator, and then again, as required by a facility. Now, the only issue with the new operator is that, BD has about 40 kits or 40 cartridges that come with each kit. So if you do have a new operator, it only comes with one positive and one negative control. So it might be a system where, we need to have additional positive and negative controls for people to run, because unfortunately, each new box only has one. And again, after the controls have been performed, you're going to want to go ahead and mark on that box, the date and time that those are performed, just so that the new operator knows that it's the external positive and negative controls have passed. Okay, so I have a video showing how to do this. So again, this is the negative control. It's in like a silver packet, and then the positive control is like, this nice red kind of fiery packet. Okay. So here, just kind of opening up my extraction reagent. So this is going to be where I'm performing the positive control. So again, you just kind of open it up. This one, the tip is going to be this kind of like red. And this is not infectious, it's just, antigen. So it's just protein. So again, you're going to want to mix nicely for 15 seconds. So it's the same protocol as you would use for sample testing. So just mix nicely into that. You're just trying to get as much antigen into that extraction reagent. And again, you should hear a click when you close the tube. Yep. Okay, and now that is ready to be added to a testing cartridge. And again, the procedure is the same. You're just going to add this to a testing cartridge, and you can either perform this into the analyze now or the walk away mode, whichever you prefer. I think if you're doing a control, you could probably just do, the analyze now mode, but it just depends on, if you have time. If the external controls, the positive and negative controls are failing, just do not use this kit for sample testing. Something's wrong. It could be something where perhaps the extraction reagent was held at an inappropriate temperature. But if it can't pass with an external positive and or external negative, then it's certainly not going to be good for patient testing. And again, we can report this to BD Veritor. They have a technical services. They're actually pretty great. I think they get back to me usually within 1 to 2 business days. So they're pretty, they're obviously pretty busy right now because a lot of people are emailing them with questions, but they have a pretty good response time. And again, any additional resources, you can contact myself. I have my email here, or Dr. Kedawell, whose email is here. So I'm going to go ahead and let's see. And again, I will. I actually added these slides to